Today I'm going to talk about IV nutrients. This will be part 3 in the series that we started. Kind of an interesting component that I like to talk to you about, which probably hasn't been addressed until very recently, and even still it really hasn't been addressed appropriately yet. Intravenous nutritional therapy, which helps a lot of people, but it also has a problem. The bags in which we're putting these different materials have microplastic particles smaller than 5 millimeters, and also nanoplastics, which are even tinier. They're below 1 micrometer, and they leach, and they can, from IV bags and tubing, especially if the material stays in the bag too long or if the bags are warm. It can even become profound. So these things are potentially can get into the bloodstream. So studies examining these IV infusions from various global brands have detected pretty much microplastic levels ranging from 9 to 20 particles per liter in glass containers, which is low, very tough to find, compared to 166 to 299 particles per liter in plastic bags. And particle sizes often fall below 100 microns, allowing many of them to bypass natural barriers. Now, in the U.S. setting, plastic dominates. A typical 250 milliliter bag, for example, might introduce thousands of these microplastics with additional contributions from the tubing, which you never think about, which is also plastic, potentially reaching 1,000 or more particles per liter in some scenarios. Now, nanoparticles under 200 nanometers are present and even more of a challenge. Recent analysis of some hospital-sourced infusion products revealed that concentrations potentially spanning millions to billions of particles per infusion, depending on the size and the material and that kind of degradation it has. The ultra-small particles derived from the polypropylene bags or PVC tubing are harder to quantify, but underscore a pretty good need why we need to look at this and what is its direct problem with the vascular exposure to these. While the full scope of health care effects remains under study, there are preliminary evidence suggests these particles could contribute to oxidative stress, inflammation, even cellular changes in many individuals that are sensitive on a long-term therapy. Immunocompromised patients may even have a more difficult time. In vulnerable groups, this may intersect with risk for like cardiovascular disease, hormone shifts, chronic conditions, though more clinical data we need to know, but be aware of this as what we're doing as practitioners. We have the opportunities to help minimize potential exposures. If you can get glass bottles, very hard to find. I used it early on in my career. That would be great because it lowers the particular release up to 90% less than plastic counterparts. Routinely, and this little trick is discard the first 10 or 12 mLs of the fluid from the infusion set. That's where the leaching is the highest for the microplastics. Inline filters at a 0.22 micron filter can capture a large quantity. Some things I've read say up to 90-95% of the larger products without disrupting flow, and that's important. Though, unfortunately, they're less effective, of course, against nanoplastics below 200 nanometers, and they're going to particularly not be trapped by these filters. But you might want to consider, if you can't find the glass bags, either bags made by polyolefin or EVA, which is ethylene vinyl acetate. They have much less leaching. And again, make IV bags when someone walks in. Do not make it, let it lay around, because that only increases the leaching, since low pH actually enhances the leaching. Now, this issue will bridge environmental science and patient care. So integrate these practical steps so you can deliver safer infusions to our patients. Thank you.